and we don't want to waste your time. So thank you so much for joining us today. I'm just trying to, there we go. So thank you very much. And you heard that that recording is happening. I'm just going to show you my face, to say hello, and just to say that I am Petra Brysiewicz. I'm a professor of nursing at the University of KwaZulu-Natal in Durban, South Africa. And it's my privilege today to be able to present this webinar. I was just going to show you my face so you can see I'm real. And I'm just going to switch off my video so that I don't waste people's bandwidth. So thank you so much for joining us today. And thank you for those of you that put your messages in the chats. It's lovely to see the spread of people from different countries across Africa. So welcome. So today I'm going to be speaking on your safety, our priority, nurses and safety culture in the emergency department. So today, I'm sure, as you know, is in celebration of the Emergency Medicine Day that's going to be taking place soon. And the theme for the day is your safety, our priority. And that's obviously the reason for the theme of our webinar today. So I wanted to really give us to focus the safety on the nurses who are working in the emergency department, particularly in this webinar. And before I started, I thought that it would be very useful to just think about the definition of safety. And it is the state of being safe, the condition of being protected from harm or from, other danger. And safety can also refer to the control of recognized hazards in order to achieve an acceptable level of risk. So, as we all know, the emergency department is quite a unique environment. There's unpredictable numbers of patients with any type of urgent and/or developing condition or injury. Often when the patients come to you, their destination needs to be decided. Do they need to go to theater? Do they need to go to ICU? Do they need to be discharged? It's a very complex place, and sociologists have done research looking at the strange environment of the emergency department. And it is a social structure with lots of different roles, responsibilities, relationships, and very significant hierarchical structures. And the ED is also characterized by the fact that it is a potentially challenging environment with very high risk for safety issues or adverse events. There are lots of hazards in the emergency department. So I wanted to just show you, I thought this was an interesting article that really just highlights the safety factors in the emergency department. And as you can see, there are numerous. They've grouped them into patient-related, provider, the health professionals, and then the environmental system-related. And I'm sure as you have a look here, you're very well aware of all these potential factors in the department that then make safety very important for us to think about. So what are the 5 safety concerns in healthcare? And this has been grouped sort of by this author into these 5 different aspects. One is around the lack of appropriate safety resources. Then there's the lack of appropriate guidelines, policies, and protocols. Poor or non-existent communication. Lack of support from management and no governance. and insufficient patient safety incident reporting systems. So in my talk, I've sort of divided it into these different sections, and I will walk you through them. So the first one I wanted to just look at is around safety and the emergency nurse themselves. So as you're all aware, you know, there's a number of things that makes emergency nursing challenging. It's about working in this strange environment that's very unpredictable, uncontrolled. The fact that we never know what patient's coming in, we don't know how many patients we're going to have, and the department can go from having almost no patients to having way too many patients in a short period of time. You see patients along the spectrum of age, the spectrum of illness and injury. And that continuum of care is very broad. You know, it means that you need to be able to deal with all sorts of things in the emergency department. The nursing outcomes in the emergency department really emphasize often the timeliness. So it's about measuring time and appropriate interventions that are then administered within this sort of time-sensitive constraints. And we also have mass casualty incident management, which unfortunately can happen quite often. We often have incidences that involve multiple patients, and then obviously puts an extra burden on the emergency department. Nurses as well are providing emergency care across a vast spectrum of environments, from extremely perhaps low resource rural settings to extremely high-tech settings. And it means that you as a nurse, if you are maybe moving from one place to go and work in another place, it can be quite a stressful thought to now have to change. And because the change between these different environments is really huge. And it can also mean that, you know, these are some of the emergency equipment that I have seen in various places. And obviously having to work in an emergency department with this kind of equipment is a whole other problem in itself. We know that there is a huge shortage of nurses, and we know that for us in Africa, we have the least amount. And this is just a graph to illustrate that, and just to highlight just how Africa is faring in terms of being underserved by the numbers of nurses that we really need. Globally, we know that there is a shortage of nurses, and that this shortage really influencing to a large extent the quality of patient care. In the US, the shortage is more severe in sort of rural areas, and in sub-Saharan Africa, this shortage is influenced by, you know, lack of training of sufficient nursing schools to train nurses, unavailability of resources, insufficient funds, etc. Then, besides that, we also have a problem in that we often don't have nurses with the relevant emergency skills working in the emergency area. And this was just a study that we did with nurses working in urban areas in KwaZulu-Natal in South Africa. And when looking at these results, you need to remember that these were the nurses themselves assessing themselves. So only 52% of them saw themselves as being highly competent to perform CPR, which is a huge, I mean, it's really is a massive problem when you've got, these are the people that are working in the emergency departments. Only 64% said they were highly competent to be able to assess mental state using a GCS. 42 were highly competent to prepare and administer drugs in a cardiac arrest. And remember, this is their self-perceived competence. If we actually had to evaluate them, that might well be lower. So we have a major problem that a lot of the nurses are really not skilled in providing the care that they need to in the emergency department. We have a limited number of emergency nurse trainers and institutions who are actually offering training, a diverse range of experience and educational backgrounds for emergency nurses across Africa. A lot of us are doing things in slightly different ways across the different countries. And we might find that countries have standards for sort of health professional training, but not necessarily for the specialization programs. I think we also have to think about in terms of the shortage of nurses, it's also about, who are the new nurses who are coming into the profession, and do we provide what they are looking for in order to ensure that we keep those nurses in the profession. And I think that this is always important to have a look at, and this was a factor that was looking at millennial generation nurses' intention to stay. And these nurses were saying that, they're expecting these things: strong leadership, advancement opportunities, good co-worker relationships, a healthy work-life balance, etc. And if these things are what's not possible, then chances are these nurses will not be staying in the place where they're working. Another really important aspect to consider is workplace violence in the emergency department, and really worldwide, this is a serious issue. And violence against the ED staff causes significant physical and mental distress, and that in turn affects the work productivity and patient care. So these authors surveyed doctors and nurses in asking them about workplace violence in the emergency department, and they reported that 67% had experienced verbal abuse, 17 had physical assault, and confrontation was reported by 11. And family members were the main perpetrator of the verbal abuse and the physical assault. And nurses and junior residents were the ones who reported more abuse. I've just put this in here because I think it's very depressing, but I think it's also something that we have to be very aware of. And this is information from the States, but that 2 nurses are assaulted each hour on average. And I think that's just something for us to really go back to our own workplace and to think about, if our nurses cannot be safe doing their work, then that has huge implications for obviously the quality of care, the retention of our staff, etc. So I think for nurse leaders, there are massive challenges currently. They have work environment challenges, this violence and safety issues, as I've said. Staff retention, there's a global shortage of nurses, and then it's a really hard job to keep the nurses that you have. There's the challenge of looking for adequately trained staff, and especially for staff to work in the emergency department, because there's very few staff who have the necessary skills. Staff and nurse burnout, quality improvements are difficult to undertake, and the patient and family experience, and again, their safety. So often when we look at the role and training of the emergency department charge nurse, the people in charge are often not adequately prepared, and often have to assume the role just maybe there's nobody else that can do it. It's not something they necessarily want to do. It wasn't their chosen kind of career path, and so they have to move into these positions. And remember that the in charge really sets the tone for the shift for the department. Often these charge nurses have lack of formal training. Their charge responsibilities are very demanding, and there's very little to assist them in this very difficult role. This was also work from our colleagues in Ghana, and they were having a look at asked nurses about the challenges of working in an emergency unit. And again, it's very much the same things: shortage of nursing staff, limited specialty training, overwhelming patient numbers, stressful working environment, and that the emergency nursing role is very challenging in Africa. So very similar things. We know that there's lots of stress in providing emergency care, and this in turn can lead to, compassion fatigue, burnout, etc. And it's really important that organizations are thinking about this and are designing interventions in order to assist their staff. Because unfortunately, if we don't, then again, it often leads to people leaving. We know that during the COVID-19 pandemic, that also placed even a greater burden on our nurses in the emergency departments, and just really made the situation even worse, so that the burnout, etc., was even higher, and really revealed the need to put measures in place to build a resilient workforce. So it really does make one wonder, how can you stay motivated despite all of these challenges? And it has, as I said earlier, been said that we really have to develop a resilience framework for nursing and for healthcare. We really need to look at what we are doing in terms of our students who are starting, in terms of our nurses who are currently working in the emergency departments. What are we actually doing to develop their resilience? And it's important to think about the fact that building resilience in the workforce will in turn improve the quality and safety of the care to the patients, as well as I'm saying, retain the very valuable staff. So we have to, as an educator, think, how are we going to teach these skills, and what are we currently teaching in terms of this? And I really do believe we have to think about teaching our health professionals along these kind of lines. We need to teach them to be responsive so that they are reactive and alert. They are watching what's happening around them, responding to the needs. Need to be resourceful and innovative. Look at new ways of doing things. Be adaptive. Be able to work with what's happening. Resilience. And a very important part is around communication skills. So the things that people like to often talk about as being very touchy-feely and not very important, I think are essential. How staff communicate amongst themselves, how they communicate with the patients and their families, etc. So I'm going to look now at the safety and the emergency patient themselves. So patient safety is a serious, public health concern. And if you have a look at WHO, they've got lots of really interesting information around patient safety on their website. And I put this down because I thought this was really interesting when I was reading it myself, that you have 1 in a million chance of being harmed while you're traveling by plane, okay, when you're taking a flight, but a 1 in 300 chance of a patient being harmed during healthcare. It's quite a scary thought. And industries that you would think have a much higher risk, such as aviation and nuclear industries, have a much better safety record than healthcare. And WHO goes further to say that patient harm is the 14th leading cause of global disease burden. So high-income countries have as many as 1 in 10 patients is harmed while receiving hospital care. And these are caused by a wide variety of adverse events, with nearly 50% of them being preventable. And in a study looking at adverse events across low to middle income countries, the rate of adverse events was around 8%, of which 83 could have been prevented and 30% led to death. Approximately 2/3 of all the adverse events occur in low to middle income countries. When you look at this, then you can see why the theme for the Emergency Medicine Day was chosen as it was. So these researchers had a look at doing a systematic review in order to find out about the learnings from patient safety incidences in the emergency department. And when they had a look at the literature, only one study provided the example of a patient role as a contributing factor to patient safety incidences. And what these authors were really wanting to highlight is that communicating with patients and engaging with patients and their families in reporting these patient safety incidences were really emphasized as a way in which to improve the safety of care in the emergency department. So patient participation in reporting these adverse events, better communication, and collaboration to ensure accurate transfer of information can really serve to assist with improving the safety. And a large proportion of the adverse patient safety events have really just been attributed to failure in communication. So we really have got some important areas that we need to look at. So here are just some, these authors put together examples of how things can be improved. And two of the major sort of areas is around medication safety in the emergency department and transitions of care. So the medication safety can be in terms of how the drug is given, how the drug is prescribed, and being able to safely administer the drug and safely administer the right drug in the right way. And the transitions of care have a lot to do with the handovers and how they are written and how the information is communicated between different healthcare providers. So it's really important that we develop a culture of safety, one that encourages teamwork, event reporting, communication openness, transparency with feedback, and learning from errors. Just excuse me for a second. Sorry, just needed to cough. Sorry. Right, let's look at safety and the patient's family. So we know that families in the emergency department are very challenging. And the family are, whoever the patient says they are. They can be legal, biological, could be neighbors and friends, could be tied to the patient in terms of other bonds, but there are lots of ways that we can define families. And we've done lots of research with families and looking at families in the emergency department and asking families about their relationship when interacting with healthcare professionals in the emergency department. And this is what they had to say. That the emergency department is bewildering, they feel powerless, etc. So why should we involve families? They play an important role in caring for our loved ones. And research has shown that they can actually be helpful in leading to positive patient outcomes for their recovery and for satisfaction with care. There's been all sorts of studies that have also been done, really looking at different outcomes from involving families, and positive outcomes have been shown in terms of diagnostic tests and adverse events, shortening length of stay, improved self-care, clinical decision-making, etc. So I think there's lots of research that's out there to show the benefits of actually involving the family. We know from COVID-19, we had to work a lot with families, working with them in different ways because of social isolation, and had to really look at new ways to communicate with families. And that had a lot of successes. So safety in the emergency department moving forward. Why is a culture of safety important in healthcare? Well, it's really to prevent or reduce errors, to improve the overall quality of the healthcare received by patients, and to keep staff physically and mentally safe in their own work environment. This is a really useful article to go and have a look at, and it's really a policy statement on minimum standards of safe working conditions in emergency medicine. And this is a statement that was put together by a large group of different organizations, and it's been endorsed by many emergency medicine organizations across the world, including AFAAN. So I know it's very busy and there's lots to read here, but basically what they've put together is these 12, listed 12 things that they say every emergency department should have. And I'm just going to go through them with you. So every emergency department should have adequate number of staff, adequate competence of staff, adequate recognition from other specialists, an adequate design of working hours, adequate physical design. And if you think back to some of the emergency departments where I know some of you are working, you know, that the physical space that you're working in is really very difficult. Adequate equipment, which I think for us in Africa, again, a major problem. Adequate supporting infrastructure. Adequate space for rest and refreshment. I know some of you would probably have got very minimal space for that. Adequate facilities for professionals with babies. Adequate equal opportunity hospital policies, and adequate psychological and emotional support. So I think these are really, it's a really comprehensive list of things, and really good to go and have a look at this article and perhaps take back to your emergency departments and say, well, maybe we should be having a look at this and thinking about this. So what are the principles of safety in healthcare? You need to create transparent and non-punitive reporting systems for adverse events. Many cases, I know people don't want to report adverse events because of the punitive nature. We need to encourage leadership to model the expected behavior. We need communicating policies and procedures and expectations around safety. Need to positively recognize staff members who identify and report safety issues, and routinely review safety measures and inspect workplaces to ensure they comply. So transforming healthcare to eliminate preventable harm really starts with a competent workforce. And the Quality and Safety Education for Nurses developed a framework that they've used in many countries to guide with this. And it's a US national plan for nurses to improve quality and safety in patient care. And there are 6 competencies that they say nurses need to achieve. So here are the 6: that we need a patient-centered care, that we need to look at ensuring there's teamwork and collaboration, evidence-based practice, so you're really using the best evidence to inform what you're doing, quality improvement, safety, identifying and alleviating harm-causing incidences, and informatics, so using informatics to support decision-making, information sharing, quality improvement, etc. So in order to promote a culture of safety in the workplace, it's important to create internal marketing campaigns so people are aware of the importance of safety and what the department is doing in order to ensure safety. You need to let people know that there is a safety issue. You need to provide appropriate training, and you need to test employees' knowledge on safety. So here's 5 steps, different authors, 5 steps to create a strong safety culture. They've suggested that you improve communication, introduce sound incident reporting systems, have a leadership that models the behavior you want to encourage, keep an eye on emerging safety issues, and actively invest in safety. So this is just a short little article from the Lancet that's just good to have a read around patient safety and the value of the nurse. And I just wanted to read what they'd said here, that advocacy for and evidence surrounding nursing workforce policies and patient safety had been increasing for decades. Building a robust nursing workforce is inextricably linked to patient outcomes and should be central to health services planning. So we know us as nursing are essential in terms of ensuring safety. So I wanted just to end with the message from Joe, our AFAAN president, who was saying we cannot do this alone, but we can do this together. And absolutely, we all need to be working on this issue together in order to improve and ensure safety in our emergency departments. So thank you very much.
Thank you very much, Petra. Wonderful presentation.
Sorry, I was busy coughing. Apologies for that. Are there any questions or comments? Mohammed, I see you have a comment in the chat. Did you want to say it? Or do you want me to read it?
Okay, may I, ma'am?
Sure, go ahead.
Okay. Well, I've been seeing nurses practicing around me for years and years, and they're all good, they're professional, they behave, they're professionally trained. But again, the lack of orientation in terms of ethics, which reduces their performance and responsibility, and really not known to them, because most of the hospitals and health facilities doesn't have a formal ethical committee. And there's one trend of having morning meetings and at least twice or thrice a week. So we discuss different experiences and different incidences happening well within the premises of our facilities. So I think the principle, 4 core principles are known to everyone: autonomy, beneficence, non-maleficence, and justice. But apart from these 3 other principles for nurses are veracity, fidelity, and one more, I think, accountability. So I think most, they practice, but they're not very well versed with it. That's what I wanted to say, ma'am. Thanks for the opportunity.
Sure. And Mohammed, I completely agree with you. And we actually have a project we're doing at the moment that we are looking at how we actually teach nurses those ethical principles, because my own thoughts is that we just teach people these ethical principles, but we don't actually teach them around how you actually apply them when you are suddenly sitting in your emergency department. And now how do you use those to guide you? And I think that's where we've often have a bit of a gap. So it's really nice to hear that perhaps as you're, with your staff in your emergency department, you are then able to talk about some of those ethical principles and perhaps make it clearer to the staff how they can be used in everyday practice, because I think we possibly haven't done that well enough in the in the basic nursing training. Thank you. I'm just going to look to see if there's some more questions. And I see there, yes, we can do this together only if we're equipped to care. Yes, I think also I would say that perhaps we don't necessarily teach our nurses enough around safety and how we ensure safety and why we should be when we are training them to be nurses, because I agree, we have to make it clear what the value is to our nurses and equip them so that they are able to do this. Emmanuel, I see your hand is up. Would you like to go ahead?
Yes, thank you, Dr. Thank you, Professor Petra, for a wonderful presentation. It's really nice to hear that safety is of important, especially when it comes to practice in the emergency department. So, yes, I agree with you 100% that when it comes to emergency department, especially when it's hectic, having a lot of patients, safety is one among the first priority, especially to the healthcare worker, a nurse or a doctor, is very important, because if you cannot take care of your own safety, it's very difficult to consider the safety of your patient and safety of your fellow workers. And when we talk of the safety, we look the safety of yourself as healthcare worker, safety of the environment, safety of the patient, him or herself. Now, when you were reviewing the different studies, I was very impressed. I'm from Tanzania, and we are having, especially in the facility where I'm working, we're having a lot of nurses who are interested to be involved in researches. And maybe my question is there a way that we can involve these nurses in different studies so that they can, because getting someone who is interested in study, if they can get empowered and given a chance to involve in different researches, they can do a wonderful job. And I think they can address more things that are very important, more even as you did in this when it comes to the concept of safety.
Sure. So thanks, Emmanuel. And then I'll answer, and then maybe there might be other people on the call that want to answer. So I absolutely agree with you. I think that if we don't look after and teach our healthcare professionals how to look after their own mental health, then they invariably leave. And that's exactly the problem. We have a huge problem with shortage of nurses, and we can't afford to to let people leave. We really want to work hard to retain them. And so I think one of the ways we know from COVID, a lot of people left because they were just too stressed, etc., had burnout. And we really need to be focusing on what we can do to better support the nurses who are there working in the departments. So that I absolutely agree with you. That's really important. In terms of the research, absolutely. Obviously, for me, that's a major part of my work is encouraging people, and especially nurses in clinical areas, to do research. And you're right. Often when you get people involved and a little bit of research, and they see it's not so scary, it can lead them on to greater things later on. One of the initiatives that I'm busy with at the moment is I'm actually working with the clinical area, and I'm working with them doing a collaborative project. So they have decided what research they want to do. They are doing all the work, and I am assisting as an expert, guiding them, because they don't know what to do and how to go about doing it. So, I would definitely encourage that you get, somebody to assist, perhaps in that regard. And these nurses are doing really well. They've never done research before, except for one of them. But they are all enthusiastic and really eager. And I would say, from the presentation today, you can see there's lots and lots of things, particularly around safety or retention of nurses, that could be so useful to do some research on. And if there is anybody who's struggling and wants to look for assistance in terms of someone to help with research, you're very welcome to email me, and I can always maybe put you in touch with someone, or I could possibly assist. It just depends. So I'm putting my email in the chat box, the chat box. Please, anybody is welcome to email me. Please, just when you email me, just tell me that it's from this webinar and what you're emailing me for. Otherwise, sometimes I get some very strange emails, and I'm unable to assist because I don't know what it's for. But thank you for bringing that up, Emmanuel. I think it's a really important point, and we really want to be helping and supporting any of our nurses who are interested in doing some research. We especially need research from our clinical areas. So thank you for that.
Thank you so much for being ready to support and to assist, especially to raise your nurses, even to reach a career like being a professor like you. Thank you so much, and be blessed.
Sure, thank you. And actually, I'm coming to Tanzania probably in January next year, so we could always set up a time to meet. See, there's a conference that you're having next year.
Okay.
Yeah.
Thank you so much.
Pleasure. I'm always happy to go back to Tanzania. Okay, I'm just looking to see anything else. I think that the recording of the talk will be available. So I see base there. Oh, Mohammed, you're also in Tanzania. I'll see you there then as well, maybe. Any other questions? Charmaine, was there anything you wanted to add in terms of safety? I know that you know a lot.
Thank you very much, Petra. It was a great presentation. I think what I really appreciated was you obviously put a lot of effort in to find all these articles that are relevant to LMIC context. So nothing to add, but thank you very much. And also happy to support with research coming through.
Oh, thanks, Charmaine. I was hoping that you would be. So those of you here have also heard Charmaine's happy to support as well if people looking for help with research. And please, there is a webinar that I did not so long ago around research, so please go and have a listen as well. That might be useful for people that are starting out with research. Any other questions or comments? We do like to close on time because we know that everybody's very busy, so I don't want to be late, but I just want to check if there's any other comments, and thank you for the kind words in the chat. I'm glad that you enjoyed the presentation and found it useful. Yes, are you wanting to say something? Would you like to go ahead? Okay, maybe not. Emmanuel, do you want us to close, or do you have anything that you wanted to say to anybody?
I think that we can close. Thank you very much, Petra, for this wonderful presentation to start us with EM Day celebrations. I think this is an eye-opener for most of us, and we'll have to be looking at ourselves and to see how best we can improve on patient safety. I think on this note, thank you all for joining us. We look forward to our next presentation next month. Have a wonderful day.
Thanks, everyone. Take care. Bye for now.